Good morning, Dr. Bhatia. Today I am joined by Dr. Ashish Bhatia, current president of ASLMS, double board certified dermatologist and Mohs surgeon. You've been in practice for 22 years.
Mm-hmm.
And you have extensive experience with radiofrequency devices. So today we've asked Dr. Bhatia to talk to us about non-invasive radiofrequency devices. Not one device in particular, but just kind of zooming out in the industry today and talking about what common conversations are as it relates to radiofrequency. So let's, there's so many different technologies out there, Dr. Bhatia. I know that you've been using radiofrequency for many years, I think since your fellowship. So you have extensive experience. I know that you're very well published. Tell me a little bit more about how you think that the industry has evolved in non-invasive radiofrequency.
Well, Amy, thanks for having me today. This is a very timely topic, radio frequency. So, it's come so far. Radio frequency devices and techniques have come so far from the days when I was working on the trials for the first approvals of radio frequency devices. They have gotten so much more refined. We know so much more about keeping patients comfortable, but still being able to deliver the energy where we need to deliver it, how we need to deliver it, and really how to optimize results. So I'm really excited about this category because we've really evolved so much from the early days, and now it's been refined where we can do these three things very safely and effectively.
Yeah, fantastic. How does comfortability affect how you choose devices? Does it affect retention or rebook?
Patient comfort and patient experience in general is such an important part of every procedure. If a patient is uncomfortable or has a poor experience, that can negatively affect their thoughts about the outcomes and their really their ability to or want to come back for another procedure. So I think it's paramount, patient comfort, and figuring out a way to optimize not only the treatment but the patient comfort is so important.
Does the patient experience and patient comfort affect your decision when purchasing a new device for your practice?
Absolutely. I think finding devices that either provide great patient comfort and great patient outcomes, or how to actually mitigate the pain or discomfort during a treatment is so essential. So either way you do it, I think it's very important, and it does affect the outcomes, and it affects our buying decisions.
You mentioned having used radio frequency since or the early days in your fellowship. Have you seen patient comfort evolve as it relates to just radio frequency or non-invasive radio frequency? Have you seen comfort improve?
Comfort's improved tremendously since the early days of radio frequency. I think we've figured out how to optimize cooling, how to optimize energy delivery, and those are two things that have really affected what the patient experience is like during a treatment.
What are the real indicators for you in your practice when you know that a device is successful?
One of the biggest indicators of knowing that a device is going to be successful or is successful in a practice is number one, patients come back, and number two, seeing the results for patients, and number three, our staff actually getting excited about doing the procedures. Because when they get excited, they see the results, they talk about those procedures more, and patients can sense this, right? Patients can sense when whoever the operator is that's going to be doing the procedure is truly excited about it or they're not. And so I think devices that deliver good results and do them in a very comfortable and reliable way really rise to the top as far as use.
How much do you feel that outcomes depend on the provider versus the technology itself?
Good question. So there's really two things, right? I feel that a device is a tool, and there's better tools and superior tools, and then there's inferior tools. On the other end, there's the skill of the provider and really the knowledge of the provider, and I think both are really important. If you have an expert and they're using the best tools, you're probably going to get the best results. But if you have somebody that's not an expert and doesn't really understand the technology, even if they have the best tool, it's hard for them to get great results, and there's higher chances of injury or issues with the procedure. So I think it's a combination, right? The people that really get the best results are the people that use the best tools and are trained very well. And so I think training is so important when you're using any energy-based device, especially RF.
I couldn't agree more. So for somebody that's newer to aesthetic devices, we go into a lot of practices where this is their first device, and we are training them. It can be very overwhelming to learn a new technology, to learn how to position it in the practice so that they're making their money back. So everything starts to kind of look the same when people are looking at different devices. It's all just a very overwhelming experience. So from your perspective, what differentiates systems and how they perform, and what should a buyer really focus on when making a decision on a new device?
When somebody's looking at a new device, the things I tell them to focus on is the reputation of the device. Is this something that obviously is FDA cleared and has a lot of use experience with it? So I encourage people to reach out to people that have the device already and speak to them and talk to them about their experience, not only with the device and the reliability of the device, but also the training that they got. Because as we mentioned before, I think training is paramount to getting good results for your patients and really having a great experience with the device yourself. And so, those are really the two major factors that I really think about. The other is really the company that's backing the device. Are they there for you? Do they really believe in the technology? Do they really want to support your practice? And those things should come through, I think, pretty quickly. So, there's generally two people you're dealing with when you're buying a device. It's whoever's selling you the device and then who's ever training you. And I think having that, sales cycle is one thing, but once you get the device, making sure you have the support to back you and then get you the latest protocols and make sure you're successful with the device is so important, because nobody wants to buy something very expensive and then just have it sit there. And unless you get good training, you're not going to have the confidence to use it and tell your patients about it and deliver those great experiences.
How do you position RF for your patients? Like, is it a one-time treatment? Do you do repeat treatments? How do you speak to your patients about this type of a treatment?
So RF is one of the treatments that we do that I think it's a good starter treatment, right? Because RF is non-invasive, which really, for patients that are needle phobic or have issues, but want rejuvenation, want to improve the quality of their skin, it's a great entry procedure. How do I position it as far as what it's going to do and what it's going to deliver? It's really kind of for the patients that want to improve the quality of their skin and want to do it easily with very little downtime. As far as the number of treatments, I tell patients you're not going to stop aging. So, these are going to be maintenance treatments. So you'll get results from your first treatment, but then set up a cycle where you're going to be coming back and help maintain those results and really fight, there's that downward aging slope that you're going to be dealing with, hopefully. And this is something that'll help you maintain your collagen, help you build collagen, help you improve the quality of your skin. And it's a maintenance thing. I think people have to get out of that mindset that it's a one and done, really, with any of the aesthetic procedures we do, because we're constantly fighting aging.
Yes, we are, unfortunately. So I get this question all of the time. I'm curious how you would answer it. Is how long will the result last?
That's a question I get all the time too. And my answer is very similar to what we just spoke about, is that you'll get a result and that result is there, but the problem is you're going to keep aging. So it's a matter of what your rate of aging is. And I think it's very important to have a lot of other complementary skincare procedures or routines that go with any treatment like this, because here you're really affecting the foundation, right? You're affecting the dermis. You're delivering energy with radiofrequency, and that helps build collagen, clear out some of the stuff that you don't want there anymore that's aged. And that's great. But, it's just like going to the dentist. You go there and you get your teeth cleaned and stuff, but if you don't brush your teeth in between, things aren't going to go so well. So, good skin care, sun protection, other procedures that help reinvigorate the epidermis are huge. Whatever you like to do, micro peels or um, chemical peels or diamond glow or something like that. There's so many options for what you can do, but it's really a combination of things. But the thing I love about radiofrequency is that it's foundational. It really helps build that base so you can do all these other procedures and help maintain your skin.
What's your favorite way to bundle non-invasive radiofrequency? What other types of treatments, or what are your common go-tos?
Yeah, so what I like to bundle with radiofrequency is usually procedures that help with the epidermis. So things that help with skin turnover. So my go-tos are usually, well, obviously with everything, sun protection, usually a retinoid to help turn over that epidermis. But then on top of it, something that's mildly exfoliative. So whether it be like a hydrofacial diamond glow or a mild chemical peel, those are things that I like to do along with it. The beauty of it is when you do a radiofrequency procedure that's non-invasive, you can do a lot of these things on the same day too, which makes it more convenient for the patient, and they see more of a result too.
I always like to use the analogy of when you're using non-invasive radiofrequency and you're stimulating collagen remodeling in the dermis. That's like a good firm mattress. But then when you're doing on the same day, you've got some treatment that you're affecting the epidermis. Then it's like you've got a nice clean comforter. So it's what you see on the outside versus the foundation in the dermis.
I love that analogy, Amy.
So let's dive into some of the question of the day, and
Okay.
what I think has been a really loud conversation in the space, and it's about over-treatment and going too deep. We get this question often, I'm sure we both do,
Yeah.
about like how deep is too deep? Does depth matter? Is there such thing as over-treatment with non-invasive radiofrequency?
That is a question we get all the time. And I think a lot of it's from just awareness through social media and what people hear. And once again, I kind of go back to the fact that a radio frequency device is a tool, and you can use it very different ways. And so the skill of the provider really does matter. The training of the provider matters, because what you do want to do is deliver energy where you want it, which is the dermis, like the mattress that you were speaking about. You don't want to deliver it deeper, and you don't want to deliver lots of it, because then you can destroy fat. And we've actually designed devices that are made to destroy fat that use radio frequency. So we know it can happen. But I think just like any other tool, it's about knowing how to use it, and really understanding how it works, and making sure you deliver the energy where it needs to go, which is going to be at the dermis or above.
So, I've heard of some technologies trying to target deeper layers in order to get a better result. What is your perspective on going deeper to achieve better clinical endpoints?
I think going deeper doesn't necessarily help, because you can get a little bit of temporary fat reduction. And so I think it's best to stay where you should be staying, which is really in the dermis. I know there's technologies that have tried to target the SMAS and go very deep. And when you do that, you can get tightening. There's other technologies that I think are better suited to going that deep and tightening up this mass. But can you do it? Yes. I think that's not the ideal place for RF, non-invasive RF.
Why do you think it's not the most ideal place?
The main reason I think it's not the ideal place is because of that potential for fat loss or fat reduction. Like I said, it's even though it's temporary, some people might be really affected by that and not want to deal with that. So theoretically, it can happen. And so I usually try to avoid that. I use other devices to try to do SMAS tightening. I really reserve radio frequency more for dermal improvement.
Tell me a little bit about other technologies that achieve some of these similar results, like tightening or collagen remodeling. There's a lot of different technologies out there. We can do it with lasers. We
Yeah.
can do it with HIFU. We can do it with radiofrequency microneedling. So
Mm-hmm.
tell me a little bit about why you choose non-invasive radiofrequency over those other technologies.
The reason I choose non-invasive radiofrequency usually is because it is it's easy for the patient, right? There's very little downtime with that. And really now with the new technologies we have, we can deliver that energy with very little discomfort. And patients actually have an enjoyable experience while they're getting it. With a lot of the other technologies, they require a little more downtime on the patient's part, like with microneedle RF. They sometimes require numbing, sometimes they're a little more painful. So even though we have every tool there is at our office, I still think my go-to, usually, especially for newer patients or patients that just can't afford any downtime, is radiofrequency non-invasive.
So speaking of the patient, if I came into your practice and I came to see you and I wanted improvements in my skin, what does that sound like from the patient? Like what are they saying is bothering them for you to say non-invasive radiofrequency is the best tool for you?
When patients come in and they look at me and they go, my skin just looks tired. It doesn't, it's starting to age. It's really showing signs of not being vibrant. Those are the patients that I usually start with radiofrequency. And the truth be told, even if they have other issues, I think radiofrequency non-invasive is a great adjunct to any other treatment. So if their issue is more deeper issues, or if it's more pigment, still you want to get in there and you want to treat the dermis, the mattress, because that's the foundation, I think, of any treatment on the face. Really, every patient is a good RF non-invasive patient, and the beauty of it is you can bundle in this treatment with almost any other treatment.
So every patient is a candidate for non-invasive radiofrequency. Is there anybody that you would not choose this tool for?
With non-invasive radiofrequency, the beauty of it is you can use it for almost any patient. So, unless there's a true contraindication, like an implanted device or something like that, you can go in and you can offer this to your younger patients, to your older patients, and really to patients that want any kind of improvement aesthetically. So, because like I said, it's foundational. It's something that will help augment almost any other procedure and help every patient look better, feel better, and deliver long-lasting results.
So you mentioned earlier that you've been using non-invasive radiofrequency since your early days in residency fellowship. So tell me, what do you think? How has the technology evolved in a good way? Like, what is the most impactful change companies have made to make non-invasive radiofrequency more effective?
Non-invasive radiofrequency has gotten so much better since I started using it 20 years ago. And, number one is safety. In the early devices, you could deliver energy and not have good contact and get blistered. That doesn't happen. These devices are very self-monitoring now, and not numbing patients, because we don't have to numb patients anymore with these. If there is a user error, which means not having good contact, the patient feels it right away and you can stop it. So we've really self-limited as far as the safety goes of the devices, which is number one, right? We don't want to deliver any aesthetic device that's not going to be safe. So number two is the comfort. I think we've really figured out cooling, and cooling that's built into the device does a tremendous job to help pay the treatment. Like I said, we don't use any topical. If somebody's very, very sensitive, we might give them like that, but I even think that's placebo in most cases. So yeah, it's just evolved so much as far as safety, comfort, and also efficacy. Being able to deliver the energy in a very controlled fashion allows us to know how the energy is being delivered and deliver optimal results.
Have you had a non-invasive radiofrequency treatment yourself?
Yes, I have had a non-invasive radiofrequency treatment, and I try to try out every device that we use in practice myself, and I'll tell you, this particular treatment is very relaxing. It's easy. I can go on with my day. I can have it at lunchtime. So that's what I love about it is I have had it, I like it, and it's comfortable and it fits into my lifestyle. So.
Have you had a density treatment?
I have had a density treatment.
How would you describe the patient experience?
I feel like when I get it done, it's kind of like a hot stone massage type of, warmth, energy. But yeah, your skin feels good afterwards. So that's the nice thing, and really no redness, no downtime. So I really enjoy it.
There's a lot of conversation right now about volume. Is higher dose better? What's contributing to the volume loss? Tell me a little bit about what you think is causing this conversation to be part of radiofrequency story today.
Yeah. I think radio frequency has really gotten into the news about, you know, issues with volumetric loss. And those are very specific circumstances. We know that radiofrequency energy can result in volumetric loss or fat loss. It's usually if you're delivering the energy too deep. So I don't think deeper is better. Sweet spot of delivering the right amount of energy, not too much, and doing the right amount of pulses as well, because that's what we found gives optimal results for patients, is when you have that combo down. And so I think once again, it goes back to training and really learning the technique. With a lot of these devices, we do vectoring, meaning trying to tighten tissue in a certain direction. Empirically, that seems to be working. I don't think there's any harm in that.
So you just mentioned not getting too much volumetric heating. As we know, the mechanism of action for non-invasive radiofrequency is bulk volumetric heating. So in one case, we're trying to achieve volumetric heating of the tissue and get the most tissue in the dermis heated.
Yes.
But then on the other hand, you can do too much of that. Tell me a little bit more about that.
So there's two factors that really go into volumetric heating, right? One is where you're delivering the energy. And, we don't want to be delivering too much energy at the dermal sub-Q junction or into the sub-Q, because that can lead to fat destruction. Number two is we don't want to deliver too much bulk heat even into the dermis, because that's how you can lead to burns, and that's how you can lead to adverse events. So that's why if you look at the devices and the protocols, you can see that there's cooling interspersed with the heating. That's not only for comfort, but it's also for temperature control. The second thing is when you're pulsing energy, you are less likely to get that overheating of the dermis. And so there's a lot of factors that go into this. It's a little more complex than people think, but the good news is there's really sound protocols that will help guide somebody, especially if you're new to radio frequency, to get optimal results without all the adverse events that we hear all the news about.
I've seen some devices out there that, speaking of technique, that are delivered in this sliding technique. It makes me wonder, how do you get consistent energy delivery if your handpiece is in motion?
Yeah.
And versus some of these other technologies that use a stamping profile. Tell me a little bit more about that.
That's very interesting you mentioned that. So, I was involved in developing devices specifically used to get rid of fat, using RF energy. And what we did find is if you're using a gliding technique in that case, and you slow it down, you actually got more fat destruction because you got more bulk heating. That is not what we want in this case. And that's why I think with radio frequency being used for dermal enhancement and aesthetic improvement, really going with the stamping technique is the best, because you know how much energy you're delivering, you know how many pulses you're delivering, and you're doing it very consistently. So I try to avoid doing any gliding type techniques, because it's very user dependent in that case, because how fast you glide depends how much energy is delivered. And it's just, even if you're an expert, it's very hard to regulate that. And so it's simpler, easier, and more consistent to use a stamping technique.
So you mentioned using non-invasive radiofrequency for fat destruction, for debulking. What is it from a technical standpoint that is a difference between a radiofrequency device that's used for fat versus a radiofrequency device that's used for collagen remodeling?
Good question. So there's a big difference between a radiofrequency device that is designed for improving collagen and improving the dermis versus one designed for destroying fat. So number one is that Usually with a device, if we're designing it to destroy fat, it's usually a 2 megahertz transducer, meaning it delivers energy a lot deeper. And when you do that, you're able to actually keep the skin cooler and deliver most of the energy into the fat. The second thing is when you're trying to do it to actually destroy fat on purpose, if you're trying to get rid of fat pockets, you need to keep that fat at a high temperature for an extended period of time. So here, bulk heating is your friend if you're trying to destroy fat. Devices that are designed just for dermal improvement, for aesthetic improvement, to help build collagen and not to destroy fat, generally, you're not delivering as much heat, and number two, and B, I should say, you're usually using like a combination transducer, or you can use a different transducer that doesn't go as deep. And so they're really designed totally different. Yeah, you'll even see the size of these transducers is very different. It's hard to destroy fat with a small transducer like we use for typical dermal rejuvenation. The ones that are used for fat, they're usually big because then the gradient goes even deeper. And so it's really the pattern of the RF, it's the size of the transducer, it's the amount of energy, and then how long you deliver it. So they're actually very, very different. I would tell you that it's probably much easier to destroy fat if you wanted to do it with a microneedle RF device and one that goes past 3 or 4 millimeters, than you could even possibly do with a transducer on most of the RF devices that are non-invasive. So, it's a theoretical issue. It's probably more dealing with delivering too much energy. You'd really have to try, I think, to get fat reduction. There's a caveat to that, though. If somebody has very, very thin skin, then it might be a lot easier to destroy the fat because there's not much dermis there and you can get down to the fat a little quicker. But otherwise, I think most of the patients we're treating, if you're using a device that's designed for dermal improvement and not for fat destruction, there's so many things in the architecture of that device which would lead to not being able to destroy fat even if you wanted to.
So you just mentioned using a 2 megahertz system to destroy fat, but then also just saying that we're trying not to destroy fat on the face, right? So I've seen some technology out there that actually uses 2 megahertz on the face. Is that to achieve fat? Like, are they achieving more dermal stimulation that way?
So there are devices on the market that are built for dermal improvement that have both 2 megahertz and then a higher megahertz transducer that work in combination. The goal there isn't to destroy fat. It's trying to use two transducers to try to also heat up the dermis in a controlled fashion. So I think even companies that have that they're just trying to heat up different layers of the dermis is what their intent is. But you just have to control the energy a lot better to be able to do that and keep it isolated to the dermis. But it can definitely be done. And a lot of that is in the programming and the algorithms that go into designing these devices.
Yeah, makes sense. Walk us through walk me through how RF actually works in skin and tissue.
So RF energy is very different than typical laser energy, which most people think about, right? When you're thinking about energy-based devices. And I love RF because it's pretty elegant how it works. So, you're delivering radio frequency, which goes through, in our case, the epidermis and dermis. And there's resistance. Every tissue has a different level of resistance that it provides to a current that's flowing. And when that resistance is there, heat's generated. And when you generate heat, you deliver some thermal energy, and essentially a thermal injury is what we're doing into the dermis. And when we have that thermal injury, the body responds by eliciting a repair response. So not only does the thermal energy destroy some of the old collagen and other stuff that's in the skin that's aged, but it also induces generation of new collagen, elastin, and ground substance, and all the parts of the skin that you want to rejuvenate. So I think of it as getting rid of the old and bringing in the new. and you're just coaxing the body into going ahead and doing that for you. So that's how it works. It's very simple.
Are there any downsides to doing this?
There's really not any downsides that I can think of to using radiofrequency energy in a non-invasive format, because the skin generally responds in a very good way to this, right? You're just forcing it to renew itself, and you're activating the fibroblasts. The fibroblasts are the cells in the skin that build collagen, elastin, and really remodel your skin. And you're just trying to stimulate them. You're just trying to reinvigorate them, and that's exactly what you do. So I think the way this works is really an ideal technology for somebody that doesn't want much downtime but wants rejuvenation of their skin.
I've heard, being in aesthetics for so many years, I've heard that we start losing our collagen, and our collagen starts breaking down as early as like 18, 19, 20 years old, which is very sad.
Yes.
But so would this be beneficial for somebody young trying to just keep what they have?
Non-invasive RF treatments are really ideal for younger people that are really trying to prejuvenate. That phrase was coined by Ken Hart many years ago, and it's really talking about how we prevent the visible effects of aging. And this is one of my go-tos. So somebody comes in and they're young, they have good skin, but they want to prevent looking like their mom, is usually what they say. This is one of my go-tos, right? Because here, without downtime, with the two things with radio frequency energy, one is that there's not much downtime, but two, it's never going to make you not look like yourself, right? There's this whole thing about fillers and toxins and changing the way I look and and appear. The beauty of this is there's no risk of that. You're going to look like yourself, just better, and a little bit younger, and you're going to keep looking younger, and that's the whole goal here. And so I think this is one of the ideal devices for prejuvenation.
I love that. Sign me up. So for someone trying to make sense of all things RF, there's a lot of different technical aspects. There's monopolar, there's bipolar, there's the different frequencies that we spoke about.
Sure.
How do you think about all of these different technical aspects? Is there something that you specifically look for in your non-invasive radiofrequency devices?
Yeah, you can get very technical about how you think about your radio frequency devices, but I think the proof is really in the results, right? There's monopolar devices, there's bipolar devices. There are devices that have different transducers that you can use. What I like to do is find a device that A, delivers great results, B, delivers them safely. C, I do prefer a device that at least has a component of a monopolar, because you can deliver the energy to any layer of the dermis that you want with a monopolar device. Bipolar is generally very shallow, and so I know with your device we have both, and so you can deliver energy in two different fashions and still keep it within the dermis. And so I like that technique, because you are heating really essentially different layers of the dermis and delivering results that patients actually like, enjoy, and are comfortable.
So it's very interesting. Our conversation has led us to technologies that treat very deep in order to stimulate collagen contraction, all the way to the SMAS.
Yeah.
And then we're talking also about this technology where you've got a monopolar and bipolar treats more superficial for more clinical results.
Yeah.
In your perspective, knowing from an anatomy's perspective, where do you think we need to stimulate more collagen, more superficial or more deep, in order to get better clinical endpoints?
I think to get the best results and get them safely, you want to be able to deliver energy at two levels, superficial dermis and the deep dermis. And as long as you do get both of those, you're going to get optimal results. Because if you think about it, if you just have a monopolar or a bipolar device and you just get a very shallow heating with superficial dermis, it will give you some improvement, right? Because the outer part of the dermis is what we see the most. But if you want optimal improvement, you want to be able to heat up the superficial or papillary dermis and the reticular dermis, which is the deep dermis. And if you do both, you're going to get the best results. And so that's why having a monopolar bipolar combo is actually pretty interesting and novel.
What do you tell patients to expect after a non-invasive radiofrequency treatment?
When I talk to patients about what to expect with their non-invasive radiofrequency treatment, I tell them your skin's going to look fresher, your skin's going to look better. You may not see anything that is drastic or dramatic, but you'll feel that your skin's improved. And I know this because I've had it done myself, right? So your skin just definitely feels better. It feels a little tighter, and you can see the results. It's funny. What we often do is treat half the face. And I've learned this from you. We often treat half the face and then show the patient the results, and they can actually visibly see there's a difference between one side of the face and the other. And so I think that's something that excites patients, and it's a great way to just show them what to expect and recognize what to expect.
When you evaluate different radiofrequency devices on the market, is there something in particular from a technology standpoint that you look for, must have?
When I'm looking at a radiofrequency device, the things that I really look for are just the experience with the device, the quality of the manufacturing of the device, and the training that comes with it. And this is the way we evaluate every device that we bring into the practice. Does it have a good data behind it? Does it have good science behind it? Does it have a good company behind it? And does it have great support behind it? Because those are the things that are going to make it successful in a practice. And so, like I said, you can buy the best tool. If you don't know how to use it, what good is it? So
there's been a lot of conversation about going deeper with radiofrequency energy devices, both radiofrequency microneedling and non-invasive radiofrequency. What are your thoughts about going deeper?
I think when you're looking at radiofrequency microneedling or non-invasive radiofrequency, deeper is not necessarily better. People worry about fat loss, and that really can only occur if you do go deeper. And so, our goal when we're doing, especially non-invasive radiofrequency, is really to help improve the quality of the dermis, right? So we don't really have to go that deep to do that. There's a level we need to get to, but we don't have to go deeper and deeper. And so, deeper is not better. And I think this is a misconception, even in lasers, that you need something so powerful that it'll go so deep. That's not true. It's really a matter of having a device that gives you optimal energy delivery where you want it, and that can be done in a lot of different ways, especially with radio frequency, because we don't need super high energies and we don't need bulk heating. What we really want to do is heat the dermis in a very controlled, predictable manner, so we can get a thermal injury that results in just the right amount of collagen production and activation of fibroblasts. And so when you can achieve that, that's ideal. So, when somebody comes and tells me, oh, this device is way more powerful or it goes a lot deeper, that's not necessarily a good thing, especially if you are not somebody very experienced with these devices, because sometimes a more powerful tool can get you into more trouble. And so you want a device that's able to consistently but easily deliver the right amount of energy in the right place, and that's what I look for, and that's what I tell people to look for when they're buying a device.
So knowing that depth is not a primary driver in clinical results for non-invasive radiofrequency, I often get asked, how deep does your device go? How deep does it treat?
Yeah.
How would you answer that?
Once again, I tell people, look, this is a tool, and the one thing that you do want to be able to adjust for is different skin thicknesses. Somebody that's a lot older and has very thin skin, you want to control that energy and not go too deep. But if somebody's young and has very healthy, thick dermis, you still want to be able to treat that whole amount of the dermis. So, getting somebody to tell you that a device can go very deep, no matter how deep you want to go, I don't think that's necessarily beneficial. I want to know, can it deliver enough energy at the right depth for any patient I'm going to treat in practice, which is going to be somebody with a nice, thick, young dermis or a very thin, atrophied dermis. So that's what I look for. I don't think that going deeper is better.
Dr. Bhatia, it's been such a pleasure. Thank you so much for joining us today and talking about all things radiofrequency.
Thanks for having me. It was a pleasure.